As we baby boomers go kicking and screaming into middle age, plastic surgery and especially facelifts are booming in popularity. One thing that keeps some folks from undergoing facial surgery is general anesthesia and the bruising and downtime after the surgery. Now some doctors are doing the surgery with local anesthesia. Maureen Pollier is clearly an attractive woman, but this acting photo was 7 years ago, and lately Maureen feels she's not looking quite as young as she used to, or as young as she'd like.
I just felt I was jolly. It was looking a little tired, and thought it was time.
Today, Maureen looks as young as her old headshot, thanks to a mid-facelift, something that's normally done under general anesthesia or unconscious sedation.
With general anesthesia, you feel like you've been hit by a truck for a couple of days. You're tired. You have no energy. You really feel like you've been hit by a truck.
But instead of major anesthesia, Maureen actually had her facelift under local anesthesia. It's a technique borrowed from liposuction. This woman starts out with a slim face, then very slowly, something called tumescent solution is gently injected into her face until her facial tissues are swollen with a dilute mixture of xylocaine, saline, and epinephrine to prevent bleeding and bruising. The hard part for the surgeon is to picture the end results when the face is so swollen.
Well, the key here is to know what exactly you need to do to get the tissues to become what you know the final product should be, and truly that's just a matter of experience.
The rest of the facelift is done in a conventional manner, and the results are the same. It's the recovery that's dramatically different. Here's our patient just 3 days after her facelift.
It seems to be less bruising, less swelling, and certainly they don't have to go through the nausea, vomiting, or just even the sluggishness for several days of anesthesia.
I was eating dinner that night and feeling great the next day, full of energy and out socializing.
Now, everyone recovers differently after surgery, of course, but the cases I saw had remarkably little bruising and swelling, and the patients were very pleased, of course.